Welcome to the More Than Teeth podcast, where true health transformation begins in the mouth. Join your hosts, Dr. Michael Bennett and Kathy Bennett, as they explore the hidden connection between your mouth and your overall health. From sleep and airway disorders to nutrition and systemic disease, they're on a mission to help patients and healthcare professionals see oral health as the gateway to total well-being. So, let's get started.
Hello, everyone, and welcome to another More Than Teeth podcast. I'm your host, Dr. Michael Bennett, and I'm grateful to have an awesome guest with us. It's Julie Sager. She's a hygienist who works for XLEAR.
Hi, Dr. Bennett. Thank you so much.
I'm so glad you've joined us today. And, today we're going to, in the past, our podcasts have been basically connecting the dots between dentistry, airway, whole body health, and just what protocols actually work in a clinical setting. Both of us are practicing. I know, I'm talking with Julie. She's practicing as I am. And so today we're going to talk about protocols that we can use as dentists and hygienists that can really help our patients and help the office flow, just help us accomplish the treatment outcomes that we really would like to have. And on top of that, the productivity improves along with that. And so from an oral and a nasal standpoint, we want to focus on some protocols. So today we're going to go deep into not theory so much as the focus is on clinical protocols. So, for example, if you've ever had a patient show up who's just extremely nasally congested, can't breathe through their nose, you've planned a bridge, 5-unit bridge, lower arch, and they're just can't breathe. Sorry, doc. Can't spray any water in there because I've got to breathe through my throat.
Right.
And that's miserable. And it can jam your schedule. Your hour-and-a-half appointment that you allotted now turns into 3 hours, and you've jammed hygiene and your restorative, and it's miserable. The patient's miserable. So there's important protocols that we're going to talk about today on how to handle that using some XLEAR products. And it's not so much about the products as it is about the protocols. What works and do these help? So thank you, Julie, for joining us.
Absolutely. Happy to be here.
Could you tell us a little bit about yourself, what you'd like everyone to know about you?
I am the education manager for XLEAR in the Western states. I've been with them almost 15 years, and so my role with XLEAR is to learn the research, the protocols, things that work on a clinical level, and share that information with other healthcare providers. So not just dentistry, but everybody from chiropractors, naturopaths, ear, nose, throat specialists. And then I'm also a practicing hygienist. I manage to squeeze in usually 1 day a week of seeing patients. So I keep the gloves on. So it's the best of both worlds.
That's great. What a wealth of experience. And you've been practicing for quite a while.
Yes, since 93. I graduated from Loma Linda back in the day.
Back in the day,
Yeah.
33 years. That's great. So between your 33 and my 27, what's that? Is that about 60 years experience between us?
I can only count to 32.
Yeah.
So.
That's right. Awesome. Well, that's cool. Well, I'm excited to dive in because as you've seen these effective protocols in practice, I'm excited to find out what they are. So what would you say would be your top 3 clinical scenarios where you've used XLEAR products in the clinic? Like same day, this made a difference in the appointment type.
I have to narrow it down to only 3.
Yeah, well, yeah. I mean, start with 3.
But no, I honestly would have to say once I learned about nasal breathing and how it gets a patient through the appointment, it was a game changer. And it took me 25 years of practicing before I realized that people who struggle to lie down in the chair, who struggle with air spray from our ultrasonics or having film in their mouth or a sensor, it's because they're not nasal breathing. And so what I started doing was taking the little mini bottles of XLEAR into practice, and I had been at my same practice for so long. I had worked with the same doctor for 22 years back in California before he retired. And so I knew the patients, the Julie only patients, those ones, the ones who struggle, the nervous patients. And I started thinking, okay, maybe it's an airway issue. And I would give them the mini bottle. I would say, okay, do 2 sprays up each nostril. I'll be back in a few minutes. And we didn't go digital for a long time. So usually I would go develop their film or do something. Sometimes I'd go and spray my own nose if the patient was sick or something.
Mm-hmm.
And I would say, I'll be back in 3 minutes because there is a published study that Dr. Steve Olmos published showing that in 3 minutes, there's a 20% increase in airflow volume through the nose. So it was my anecdotal observation, but it was also proven and published. So the
Yeah.
patients would it was really funny because they would always try to hand it back to me. I'm like, no, that's yours to keep. But they'd say, what is this? Why can I breathe now? So then I'd lay the chair down, and we'd start to talk. And sometimes I'd have to remind them, okay, breathe through your nose. But we would be able to get through the appointment. So pre-procedural spraying is huge.
Okay, I love that. And interestingly, I was a part of that study. I contributed data to Steve
Oh,
Olmos in that, and that's really cool. And it's true. I see that all the time in my clinical practice. So
mhm.
very
It is.
cool. Very cool.
It's amazing. I had a patient one time. He worked in the ER at one of the Kaisers, and he had taken the whole day off just to come in for his cleaning.
Hmm.
And he had pneumonia. He had been like diagnosed with pneumonia. He was so sick, but he didn't want to reschedule. He didn't want to have to take another day off work. And usually I will reschedule sick patients, but I'm like, this poor guy, like, let's just get it done. He couldn't stop coughing long enough to take x-rays. And so I said, okay, here's some nasal spray. I want you to use this. And I gave him a few minutes to kind of settle down and get his system settled. And I'm not kidding. We did the x-rays, we did the prophy with ultrasonic water, the whole deal. He didn't cough once. He
Hmm.
was able to control his system. And, I think when you're not nasal breathing, your whole body tenses up. You're getting a cortisol spike, and it's just your system goes into fight or flight almost, and it makes people even more nervous. So breathing just settles you down so well. And
Yeah.
he was able to get through the whole appointment. It was almost too good to be true, but
Yeah. Yeah.
yeah.
That's cool. Because you think about when we have a hyperactive gag reflex, or they just can't tolerate the appointment for whatever reason because they can't breathe through the nose. When you open up that nasal airway, you're telling the brain basically, hey, stop worrying about your airway so much.
Yeah.
Stop being hypersensitive to anything that gets close to it, mirror or
Right.
whatever it is, suction. And now we're not dealing with as much hyperactive gag reflex too, which means you can finish your procedure a lot quicker,
Mhm.
which I found that. And the other important nugget here today is when we point the bottle into our noses, we have to make sure that bottle is pointed in properly. And I didn't realize it until I studied the anatomy of the turbinates of the nasal
Yes.
pharyngeal space. And it's literally parallel with the earth. So don't do it like the commercials up the nose. Do it in the nostril, bend your head down, spray, spray, sniff each side, and you'll get the benefit of it on the turbinates where you want it, not
Yes,
up into the superior turbinates where you get a allergenic response, mucus response.
exactly. And it's harder to do when you just have the mini bottles,
Mhm.
but with the full size bottle
Yeah,
and the larger cannula designed for adult noses,
yeah,
I always tell the clinicians or tell the dental people it's kind of like giving a PSA. You want to go up, in and back,
yeah, yeah.
get it over that lower turbinate if you can. And
Uh,
it really is so effective when you're able to do that. And also will reach into the eustachian tube. So I don't know if a lot of people know the history of XLEAR, but this nasal spray was invented for pediatric ear infections. And so not only is it helping our airway, but the xylitol will travel into the eustachian tubes, especially when we're able to direct it up through the nose directly like that. So I'm so glad you said that because it's important.
that's great. Could you run us through a little bit of the science of xylitol and its mechanism with the microbiome of the nose?
So what xylitol is doing in the nose, for a long time we thought xylitol was, excuse me, for lack of a better word, the antibacterial in the nose. And then when COVID came around, we actually started testing it. And we found that xylitol is an anti-adhesive in the nasal membrane. So that's one of the things it's doing there. But it's a mucolytic, and so it's thinning the airway surface fluid, which is a fluid that is directly on top of the membranes. It's not your mucus, but it helps to propel the cilia and washes everything out. So it's really multifaceted how it works. It's also an anti-inflammatory. Xylitol has been shown to be, it reduces cytokine-induced inflammatory response, and in healthcare, we know what a cytokine response is, but during COVID, that was a buzzword, the cytokine storm. And in the nose, that manifests as congestion. So xylitol has a hypertonic property, and it will pull excess moisture that's causing the swelling. It will pull it out of the interstitial spaces and help to reduce the swollen tissues. So,
Wow. So many mechanisms of action to get that airway open. Essentially, so you're saying, let me make sure I understand. So it thins out the mucus, the thick snot, right? The
yes,
thick mucus in the nose. It also reduces the inflammation in the actual mucosal tissue of the nose by that hypotonic osmotic gradient. Okay, that's cool. And then it's also, so it's not bactericidal, you're saying, or is it?
right. It's not. Now, in the oral microbiome, it works to stop replication of acetogenic bacteria or acid-producing bacteria. But in the nose, it's a different ecosystem,
Mhm.
and what it's doing there, it's acting more as the anti-adhesive to
Okay.
airborne pathogens. So what we found, the second active ingredient in clear nasal spray is grapefruit seed extract. Now, a lot of people say, oh, grapeseed. No, it's not grapeseed. Grapefruit seed extract. And that is we used it originally as a preservative in the formula, but it's a very powerful antibacterial, antiviral, antifungal.
Mhm.
And that is what's killing the airborne pathogens. I
Okay.
mean, it's so powerful, it caused a lawsuit against the government. The government sued us because of how powerful it was. And
And lost, right?
they lost. Yeah. They decided they didn't even want to pursue it
Yeah. Wow.
because the science is just there.
Mhm.
It's irrefutable. And the grapefruit seed extract. Now, one thing I get this question several times a week from people when they start recommending Clear and they say, oh, no, grapefruit. And they want to be very careful if a patient is taking a medication where that might cause interaction, benzos, statins, different medications. But grapefruit seed extract, it's not from the citrus part of the plant. It doesn't have that interaction that grapefruit will have with medications. It's a whole different animal.
Mhm.
And people that supplement with 350 milligram capsules don't have any interaction. So just the very minute amount that's in a nasal spray it's not anything to be concerned about. So
That's a great point. That's a great point. I was just thinking my father-in-law is on lots of medications and he was eating grapefruit, and those medications were pushing his symptoms too low. For example, low blood pressure.
yes,
So the liver isn't being affected by the grapefruit seeds. It's only grapefruit itself, the
yes,
vegetable flesh. So
yeah, correct.
boy, that's a great point. Such a great point. And I love that you brought up that you used that product yourself as a provider when a patient came in who was especially sick. And the reality is we're living in a cesspool of aerosols
Oh,
in the dental office. Really, so it would make sense prophylactically to keep our noses clean and more immunodefensive by using that regularly. I'm gonna use that next week. I'm gonna use it, or
oh,
this
it's
week, I
so
guess.
true.
Yeah.
Anybody that's in aerosol, I mean, dental providers, hygienists are actually higher risk than dentists because of
Hmm.
the exposure time. And
Hmm.
we don't usually have the luxury of a high-speed suction to help us with all that aerosol. But we're, like what, 15 working inches away from bloody contaminated aerosol.
Yeah.
And it's really important that we protect ourselves. The number one reason for a dental professional missing a day of work is an upper respiratory infection. And
Yeah.
so much of that can be prevented just by spraying your nose.
Mhm.
And it's very gentle. Like I said, this was invented for babies,
Mhm.
infants.
Mhm.
And it's so helpful, but it's so powerful and gentle at the same time.
That's so cool. Well, let's talk about the mouth now. Let's talk about what protocols would be helpful if you have somebody with dry mouth, caries prone, high risk, that kind of a scenario, and or perio as well.
Ah, Perio.
Hmm.
That's a good one. It's interesting because there's not much research on xylitol and periodontal pathogens. But in 2011, Journal of Perio, Journal of Periodontology, did publish that xylitol was an effective agent at reducing P. gingivalis. So that's huge, but it didn't get a lot of press. You start to reduce biofilm and you're going to have a healthier environment. Most of, all of the research has been done on caries reduction, and that we know it's so effective. A xylitol in the mouth has been shown to consistently reduce decay 70 to 90% across the board every time. And this is research going back literally decades to World War II. And the protocol, and it's interesting because a lot of patients are discovering xylitol. I just heard last week from a patient, my last patient of the day, he walked in the first thing, and he didn't know me. He didn't know I worked for XLEAR or anything. First thing he said to me was, he's like, I just started using a xylitol toothpaste, and I'm so curious how my mouth is doing. I said, oh, you just made my day. Let's talk. So the word is finally getting out there how effective this is because patients know they don't want to kill the healthy flora.
Hmm.
They are fine. They are catching on to that. Patients are so smart now. And the great thing about xylitol in the mouth, it doesn't kill the healthy flora. It kills, I shouldn't say it kills, it modulates, it reduces the replication of cavity causing bacteria. So in the mouth, if you can, the goal is to balance the microbiome. So every time we eat or drink, the pH shifts and the bacteria loads shift. And when you get xylitol in the mouth, it neutralizes it within minutes. I've done this on with so many groups. Like if I've been speaking, I will pass out pH strips after people have been having coffee and orange juice and things like that. And we'll test the pH, and it's usually very acidic. And then I'll say, okay, two two pieces of gum or two mints in your mouth for 3 minutes, and I'll set a timer, and then we retest the pH. Without fail, it's neutralized. And if it will also work if the pH is too basic. So those are the patients that come in and they have a lot of plaque and calculus, but they never get decay.
Hmm.
Right? So it will neutralize it. And that's the trick to having a successful xylitol protocol is to have xylitol in the mouth to balance out what we do to it through the day, the exposures, because we don't just eat 3 meals a day anymore. We're grazing, we're snacking. It's changed. And the food that we do have, it's so processed, it's so full of sugars and preservatives and things that can be harmful to the mouth that this will come in and balance it. So you can't just have toothpaste to really see the best xylitol benefits. You'll get some. It's about a 10% reduction in decay just from using a high quality xylitol toothpaste. But if you really want to see a difference, if you want reduction in plaque, if you want reduction in tartar buildup or calculus, that's when you want to get the xylitol in the mouth. So you're providing that anti-adhesive barrier to the teeth. So the biofilm can't just get a foothold and just sit there and hang out all day. And it's also going to keep the pH neutralized. So morning toothpaste and mouthwash, meals and snacks, just follow up with a couple pieces of gum or mints. Let it hang out in the mouth for a couple minutes. That's all you need. And then brush and rinse before bed again. So don't take all your xylitol in the morning. It's not going to do you that much good. Just keep in mind, just you're balancing the mouth.
Okay. So
Yeah,
pop it in after the snack, chew for 2 or 3 minutes, spit it out, you're done. You kind of rebalanced.
exactly.
Okay.
Exactly. And the spry gum, it it doesn't last a long time. We
Mhm.
don't put any chemicals or anything artificial in there that's going to keep the gum lasting a long time. So the key is really when the flavor's done, it's done its job and toss it, you know.
Mhm.
You can keep chewing longer if you want. I usually do, but you don't have to for the caries reduction benefits.
Okay. And then for periodontal disease protocols, what would you recommend for that? After you've done a nice scale and root plane, everything's looking good. What would you prescribe?
I love the spry mouthwash for
Mhm.
that. I really do. This I have all my products here on the
Yeah.
table because I'm always using them. The this this is my favorite one, the spry. There we see. Let me see if I
Hmm.
can get a good view. The spry mouthwash, the alcohol-free version. This
Hmm.
is our healing blend. And it is so nice. It has erythritol. So erythritol is another sugar alcohol that's very good at reducing biofilm in the mouth. Chamomile, olive leaf, marigold, thyme, aloe, as well as calcium. So it's helping to pull minerals into the teeth. But this is a great one for post-op, for post SRP, anything you're doing where the tissues are going to be affected and they just need some real gentle TLC that's also going to be highly effective at reducing the biofilm.
Hmm. So once a day rinse after, or
I
twice?
like twice a day.
Twice a day? Okay.
Yeah,
Okay.
it's really nice, and the thing with these products is because they're not harming the healthy flora of the mouth, you can use them as often as you want. So,
Hmm.
like with the dry mouth products, that was going to be my third example.
Hmm.
Um, patients are always like, how often should I use this? Really, as often as you want, whatever
Yeah.
makes you comfortable.
So you can't overdose on it.
You can't. No,
Yeah.
people do
Yeah.
get concerned about that, and rightly so. There are some really interesting things that people write in their blogs that are really unfounded, but no, you can't
Yeah.
have too much xylitol.
Okay.
So,
Good to know. Bad breath, dry mouth, they kind of go hand in hand too. What's your regimen for that?
oh, number one, cleaning the tongue. Get
Hmm.
in there, clean that tongue, whatever you want to use to get it clean. That is going to be your best bet for bad breath, getting those volatile sulfur compounds out of the mouth. Xylitol is huge at that because it's reducing plaque wherever it is. So if it's residing on the tongue between the papilla, xylitol, especially for kids struggle so much with cleaning their tongue. It's really effective at keeping their tongues clean. I will say this, anybody that comes in and any of my patients that have ever come in and they're worried about bad breath, I tell them we have to look at the tonsils. And the only way to reach the tonsils really is through the nasal pharynx, and that's where you've got to come in with your nasal spray.
Hmm.
Right? That is going to drip down the back of the throat if there are tonsilliths or pharynxoliths. Pharynxoliths can be up there where we can't see them
Hmm.
visually, but they can be up there and cause somebody to have, an oral malodor. So
Hmm.
that will really reduce because they're little balls of
Hmm.
bacteria
Hmm.
and the xylitol will break up the bacteria, the biofilm, and help dislodge them.
Yeah.
So those are two really important things, the tongue and the back of the throat. Cleaning the mouth, very obvious, but those are the two that I always look at first
Hmm.
because, and then of course, making sure people have something in their stomach in the morning to absorb any acids that might be where the odors might be coming up from the digestive tract. So,
Hmm. Hmm. Yeah, I
yeah.
love that. Okay, that's great. That's really great. So, what about children? Do you alter the dosage with children?
Actually, it's the same. That
Same.
is such a good question. It is the same.
Hmm.
And so it's just getting the xylitol in the mouth morning and night when you brush, and
Hmm.
then after meals and snacks, balancing
Yeah.
the mouth. Hmm.
So I
So,
was thinking that my airway orthodontic cases actually would really benefit from some exercises with chewing gum. we've got to get them using their elevators to stimulate bone growth. And so I'm thinking,
Yes.
I need to do that. So thank you
Yes.
for inspiring me
You
on that.
know,
Yeah, that makes sense.
and somebody told me this a long time ago, and it's, you know this, but for the patients that might be listening, chewing gum, the spry gum does not stick to bands, brackets, and wires,
Hmm.
and or anything, any fixed prosthetics in the mouth. So fixed bridges, implants, they're going to be okay with this. Now, don't use the gum with aligners. That's a whole different thing. And that's another case scenario that people really need help with because their decay rate really increases when they go in aligners. But the protocol for that is don't be afraid to chew the gum if that's what you've got going on. Oh, what I was going to say, I digress, sorry. The chewing gum actually helps your teeth move faster. We know that as clinicians, but if you have any of your patients are listening, don't be afraid to chew gum that won't stick.
Yeah, yeah,
You'll
totally
you'll
makes
get there
sense.
faster.
You'll activate those stem cells. You'll get more skeletal growth because you're working the muscles which pull on the bone, which form follows function. And we can, I think, add a nice little positive aspect to growing the airway, especially in children. And then
Oh,
that totally inspires me just to no end to think that we as dental professionals can affect this vital respiratory system in such a way by helping the mouth form to its proper side. Let's keep
oh,
wisdom teeth when we can, kind of thing.
oh my
Grow them.
goodness. I love it when I see a patient whose jaws are wide enough that they don't have to go get their wisdom teeth
Yeah,
out.
yeah.
It's fantastic. So,
Oh,
yeah.
this is
And
so good, so good. Sorry, go ahead.
no, I was just going to say too, one thing, if people needed a recommendation for children's products, and I obviously work for XLEAR and we make the spray products, but our kids' mouthwash, it is so good, you guys. I will say I love this. And also for patients who have any kind of oral ulcerations where they can't have mint, patients undergoing any kind of like oncology treatment where their mouth gets real sore. This is so good for the kids. And it's been shown that, compared to the big brand name mouthwash that is actually been found to kill healthy flora, this one's really effective for the kids. So
Awesome. So good. I'm glad you brought that out. That's
thanks.
excellent. Well, we've covered a lot of ground actually. Halitosis, we've covered perio, high risk caries, nasal congestion. There's just so many things that healthcare provider in the dental setting could benefit their patients by using these things. So thank you for that. I hope that the listeners will key in and maybe share this episode with your team, with your hygienists, with your group to see if there are some things that might help. I know for me in my clinic, there's going to be some implementation innovations there too. So thank you, Julie. Thanks for your time. You're the best.
Absolutely. And for any dental teams out there, you can get a hold of me through the company, or Dr. Bennett has my contact information. I'd love to come do a team training for your office and just help everybody understand the science and the protocols behind using xylitol successfully with your patients. So please reach out if you'd like.
Okay, I'll be your first in this. Thanks. Take care.
Thank you so much.
Okay.